ರೆಕಾರ್ಡ್ ಆಗ್ತಿದೆ ನಂಗೆ ಗೊತ್ತಿಲ್ಲ.
अतुल सुरू करूयात का आपण?
हो करूया सुरू आपण.
कारण लोक आहेत तसे. अतुल
हा करायला हरकत नाही. डॉक्टरांचा व्हिडिओ चालू नाहीये.
हेलो वीडियो चालू नहीं ಏನ್ ಮಾಡಬೇಕು ಅದಕ್ಕೆ?
व्हिडिओ चालू है अभी चालू हो गया.
गौरी दोघेही आहेत ना?
हो म्हणजे आवाज येतो त्यांचा व्हिडिओ दिसत नाहीये. डॉक्टर वी कांट सी यू डॉक्टर.
हेलो
वी कांट सी यू डॉक्टर.
what should I do? I don't know. I'm new to this.
No, is there a video button on your phone? You are on your phone or any other device, laptop?
Yeah,
I'm on
started.
the
It start. Are you visible now? Yes, yes.
Yeah.
Okay.
Me myself Dr. Prashanth. This is Dr. Ram.
Yes. Now we can see you.
Hello, nice to see you, Miss Gauri.
Yes. I'm also glad to see you.
Nice to see you all. Nice to see you all.
Nice to see you all. Yeah.
नमस्कार डॉक्टर.
Namaste. I can see 1, 2, 3, 4, 5, 6, 7 of you.
They'll join shortly. And doctor, be prepared. There are going to be a lot of questions for you later on.
Sure, ma'am. We'll answer whatever to the best of our ability.
शोभना आपण सुरू करूया.
नमस्कार मंडळी. मी पार्किन्सन मित्र मंडळच्या मासिक सभेत आपल्या सर्वांचं स्वागत करते. आजचे वक्ते आयुर्वेद तज्ञ डॉक्टर प्रशांत जाना आणि डॉक्टर राम हे थेट पुत्तूरहून आपल्याकडे संवाद साधणार आहेत. डॉक्टर जाना, डॉक्टर प्रशांत जाना आणि डॉक्टर राम पार्किन्सन मित्र मंडळ की तरफ से मैं आपका हार्दिक स्वागत करती हूँ.
Thank you, ma'am.
खर तर डॉक्टरांची व्याख्यान आम्ही खूप दिवसापूर्वीच पासून डॉक्टर विद्या काकडे असं म्हणत होत्या की आपण व्याख्यान ठेवूयात, पण त्यानंतर करोना झाला, आमच्या ऑफलाईन सभाच झाल्या नाही आणि तर गौरी इनामदार, नंतर प्रताप वळामे आणि मेहतानी हे सगळे तिथे जाऊन आले आणि त्यांच्या सकारात्मक अनुभवानंतर बऱ्याच जणांनी आम्हाला विनंती केली की तुम्ही डॉक्टरांचं व्याख्यान ठेवा, त्यांना बोलवा. तर डॉक्टर इथं पुण्यात यायलाही तयार होते, पण ते आपल्याला प्रॅक्टिकली आता ऑफलाईन करणं शक्य नव्हतं झूम वरून. आणि दुसरं महत्वाचं म्हणजे परगावच्या लोकांना मग सामील नाही होता येत, तर त्यामुळे आम्ही हा झूम वरून ठेवणं पसंत केलं. तर आज आपल्याला सगळ्यांनाच म्हणजे आता बहुतेक डॉक्टर हिंदी किंवा इंग्लिश मध्ये वगैरे असं तुम्हाला सांगतील. आणि तर मला वाटतं की सर्वांनी सगळेजण तुम्ही आता हे ऐकायला उत्सुक असाल. आणि मला आणखीन एक इथे सांगावंसं वाटतं की तुमच्या समोर आम्ही वेगवेगळे पर्याय मांडत असतो आणि यांच्या व्याख्यानाबद्दल तरी खूपच मागणी होती, त्यामुळे आम्हाला हे ठेवणं गरजेचं वाटलं. आपापल्या जबाबदारीवर सर्वांनी कुठलाही पाठीचं किंवा कुठलंही हे करणं हे आपापल्या जबाबदारीवर ट्रीटमेंट घ्यावी असं मला फक्त सुचवावंसं वाटतं. आणि मी आता गौरीकडे सूत्र देते. गौरी ओळख करून देईल डॉक्टरांची आणि कार्यक्रमाला सुरुवात.
So this is Dr. Prashanth Jana and Dr. Ramchandra Kumari. They are from Puttur and I had been to their center for I stayed over there for 1 month, 32 days I stayed over there for my treatment of Parkinsons. And I had already told you the benefits which I received there. So I was very keen that doctor talks to you all, our group, where there are many Parkinson patients. The Shubhankar and the Shubharthis, the patients and the caretakers should understand why Ayurveda, what kind of treatments they are giving, and what are the solutions for Parkinson. The title as itself, it suggests the effective Ayurvedic treatment for Parkinson. They have given it a title. And For 1 month, the period I stayed over there, I got to know these two doctors very closely. I observed them closely. I observed their style of working, their closeness to the patient, their the love and care which they take towards their patient. All these things I observed very closely, and I was highly impressed. Both the doctors are highly qualified in Ayurveda. They have their Ayurvedic degrees. Dr. Ramchandra has done his post-graduation in counseling and psychotherapy as well. And Dr. Prashanth has done his post-graduation in integrated medicine. So he is able to treat allopathy from allopathic angle also and Ayurvedic too. And these doctors are practicing for more than 20 years. They have treated patients from over 50 and more countries all over the world probably. Dr. Ramchandra has worked in Muscat as well, and he was in Bangalore too. So they have a very good wide experience of treating patients. As Ayurveda doesn't differentiate between diseases like Parkinson is to be treated or any other disease is to be treated, there are no watertight compartments. They treat a patient as a whole. So with Parkinson, the patient could be having any other morbidities, also comorbidities as we call, like diabetes. One could be having leg pains, spondylosis also. So all these diseases are treated here because the person is treated as a human being and not particular disease-wise treatment is given. So I mean, I request both the doctors to start their lecture on this, and later on people can ask you questions about your therapies and your treatments. You can start, Dr. Prashanth.
Thank you, Ms. Gauri. Nice to hear from you. And I guess this is Dr. Vidya Kakade is also here. Nice to see you, ma'am. Namaste. Namaste. Okay. We have been treating various conditions with Ayurveda and concentrating more on neurodegenerative disorders like Parkinson's disease, PSP, and associated conditions like MSA, CBD, SCA, and different conditions. We are also treating, as Ms. Gauri said, ortho cases, skin cases, and spine-related cases also. Also, some of the specialties that we are offering is for treatment of delayed milestones in child, like cerebral palsy in the kids. We are getting excellent results. And in all these conditions, we suggest that the patient stay with us for about 1 to 2 months in the initial first course of the treatment. 1 to 2 months of admission is required, and we have been successful in making a lot of wheelchair bound patients able to walk home, walk away from the hospital. Those who have come on wheelchair, those who have come on stretcher are happily going back walking. That is the power of Ayurveda, which we have been able to treat the patients with. Okay. And specific disease related questions you can ask, and Dr. Ramchandra will be happy to answer all of you. And anything particular about the hospital, I'll be talking. You can start any questions that you want.
Doctor, let us not start directly from the questions.
Okay.
Let us start with the subject that you had given a title that effective Ayurvedic treatment for Parkinson. Okay. So explain why Ayurveda is better for Parkinson than allopathy, and what is the distinct benefits of Ayurveda. So you speak first, and then at the end, last 10 minutes, we'll have questions.
Sure. Dr. Ramchandra will be talking to you now, and he will be explaining everything about Ayurveda and about the treatments for Parkinson's disease.
Thank you, madam. So, as you all know, Ayurveda is one of the ancient recorded medical science in the whole world. And especially, we must be proud that it is from India. So, we should always be proud that Ayurveda is from India. So, we must all be happy that we are doing something to bring back a small smile on the face of the patients. Okay. So here, as such is concerned, Ayurveda believes in holistic approach. Ayurveda believes in holistic approach of any treatment, for that matter, Parkinson's or any other disease for that matter. But when it comes to especially when it is when we are talking about Parkinson's disease, Ayurveda explains certain conditions called Kampavata. Kampavata, which has been explained in Ayurveda classics. Ayurveda classics, uh, maybe something like 3,000, 4,000 years back, which explains that because of the increased vata, which is mainly in the head area, that is mainly in the head area as well as in the whole body. That's altogether a different issue, because vata has got 5 different components. When vata increases in the body, that particularly when vata affects the nerves, so that causes the Parkinson's disease. That's what Ayurveda says. That's a simple explanation in the classical text what we get. So in the later stages of the evaluation of the Ayurveda, they explain so many other symptoms along with that. Ayurveda basically explains when a patient gets increased vata in his body, leading to kampa. That is, kampa, as we all know, is tremors. So when a patient is having symptoms like tremors and associated symptoms, then it is considered to be the Kampavata disease. So when it comes to Kampavata disease, basically Ayurveda says that there should be a comprehensive treatment so as to bring out excess vata which is present in the body. Okay. So Ayurveda believes in 2 types of treatment basically. One is Shamana Chikitsa, another one is Shodhana Chikitsa. Shamana Chikitsa is nothing but for any disease, you just give some medications so that the symptoms are subsided. And another treatment what Ayurveda believes is Shodhana Chikitsa, that is, it's nothing but cleansing therapy. So in Ayurveda, at this hospital, what we are doing is we are combining this Shamana as well as Shodhana therapy together so as to make the patient better. That is, so as to reduce the vata which is in excess, so that patient gets relief from his disease. Okay. For that, what we are doing here is very classical Ayurveda treatment, which is very very elaborately explained in classics, like Snehapana, Vamana, Virechana, Vasti, and Shamana medicines. Like that, the list goes on. So it's that depending upon the personal strength of the patient. If a patient is fit enough to undergo all cleansing therapies, we advise him cleansing therapies. Or else, depending upon the patient's condition, we advise a suitable suitable treatment program. Along with that, of course, so as to make the patient feel much better, so as to give extra result to the patient, we advise, of course, yoga therapy also, as well as some physiotherapy as well. So basically, Ayurveda here in Parkinson's disease, what we are talking about, basically emphasizes for a comprehensive control over vata. That's what we are doing it over here.
A comprehensive treatment plan based on the patient's condition is prepared, a protocol is prepared, and depending on the condition, usually we plan 2 sessions of Ayurveda every day for the patient. The 2 sessions include a lot of body works like different massages, medicated massages for the body and for the head. And we also offer 1 session of physiotherapy and 1 session of yoga every day to each patient. Plus, of course, depending on the need, we will be formulating a lot of internal medicines also to the patient. But most important, most of the patients who come to us will be suffering from years together, and they will be on most of the time, certain allopathic medicines for years together. So we do not suggest that you stop your medicines immediately. Most important point, we ask you to continue with your current medication, and concurrently we will be starting our medicines also. Depending on the response of the patient, we may be able to reduce certain current allopathic medicines that you will be taking. But this is not mandatory. This is not a definite plan that your medicines may be reduced or not. We will not be able to assure right now. But ultimate effort of the treatment or the aim of the treatment will be to make the patient comfortable with your medicine, with our medicines, with our therapies, with all things put together, to offer a better life to the patient.
Yeah. And here, madam, basically, it's a holistic approach, multidimensional approach, because most of the time, by the time the patients they reach over here, they would be just like as sir said, they would be suffering same conditions for 5 years, 10 years, 15 years, like that. So here at this point of time, sometimes as the disease advances, as the disease progresses, ultimate aim of the treatment is to make the patient better, to improve his quality of life, and to bring back some sort of smile on his face. And as Gauri Madam asked in between, as Gauri Madam asked one question, like why Ayurveda? Why Ayurveda for Parkinson's disease? Madam, it is very clear. Only taking medication that is from Western system of medicine or Ayurveda system or whatever it may be, just only taking certain medication like target specific medications like Sindopa, or maybe you might have heard about some medicines like Kapikachu and all. They will not give you a comprehensive relief from the problem. Here, what we need is to rejuvenate the whole system again so as to correct the problems. This point is very important. I would like to just emphasize on this particular point. Here, important thing is so as to rejuvenate the whole system by applying Ayurveda principles. By just like as sir explained, like different therapies, different type of cleansing therapies, different types of medications. So all things put together, important thing what becomes is patient should be rejuvenated, because here, as we all understand, the brain is undergoing a lot of degeneration. Brain is undergoing a lot of degeneration. A lot of chemical changes are happening in the brain. A lot of neurons are getting destroyed in the brain. So ultimately, what should be done is we should try our maximum level best so as to preserve the remaining neurons which are capable of producing dopamine, as well as overall is like overall strengthen the brain and overall strengthen the nervous system. And as we all understand, the treatment is done for the whole body. When the treatment is done for the whole body, it is very clearly understandable that all of our system, like maybe our musculoskeletal system, nervous system, maybe our digestive system, maybe our auto conditions, and our circulatory system, everything becomes better. So here, it's not just treating one particular symptom by just giving some one particular medication like what we call dopaminergic medicines or something like that. It is to rejuvenate the whole body, whole system, so as to improve the functioning of the brain, so that when the brain function improves, when the brain is capable of performing better, the improvement which is felt in the brain will be transferred to the body as well. That's what is the basic concept. So when compared to just controlling the symptoms as thought in other systems, our idea is to rejuvenate the whole body so that patient gets better in all the aspects, and his his overall well-being is also taken care of. So, Gauri Madam, hope you understood what I'm telling.
Another important point I'd like to stress here is there is a common misconception that Ayurveda medicines or Ayurveda practitioners use a lot of steroids or allopathic medicines masked as Ayurveda. I'd like to make it very clear that in this hospital, we are using 100% Ayurveda medicines, branded sealed medicines. There is no hidden formula. All the medicines that we are used are totally transparent. You can examine yourself or subject it to any kind of lab investigation at any point in time. And we are 100% confident of the products that we are using. Because as many people do have the notion, and it is also going on, there are black sheep in every community. Lot of steroids, and also in case of Parkinson's disease, Syndopa being mixed with so-called Ayurveda medicines and masked or projected as Ayurveda products is happening around. But in this hospital, you can be rest assured that you will be getting 100% authentic Ayurveda. One. Second thing also of equal importance is the enormous cost involved in the month-long treatment plan. This hospital is one of the very few Ayurveda hospitals in whole of India that has been registered in the National Insurance Registry. So all your insurance claims will get settled easily. There has been no rejection in any of the insurance claim till date. Hence, health insurance policy holders, you can claim whatever payment you make with us. So that takes care of most of your cost. I think Ms. Gauri just got reimbursed for the maximum for whatever she has paid for the treatment.
What makes us different from other hospital is, though it's traditional treatment, traditional medicines, everything, so combination, how we apply it to the patient, like whatever the treatment or whatever the medications or whatever the therapies or whatever the physiotherapy, yoga or whatever, this proper combination of the treatment, of the medicine to the patient as per the we understand patients, what we call Prakriti, Vikriti, and so many other things. I think you all might have heard about it. So, depending upon patient's Prakriti, individually selecting the therapy, selecting the medications, and applying to the patient is what our specialty. That's where we are different from others.
I would like to know what specific points you want me to talk more upon.
Can I ask question, doctor?
Yes, sir.
Sure, you're welcome.
Hi, this is Milind Joshi here. I'm from Dubai. I just start my video.
Okay.
Hi.
Hello, sir.
Hello, sir.
How are you?
Doing
Thank you,
good.
doctor, for nice information. Thanks a lot for sparing some time for us. I'm a patient. Okay, I'm a young onset Parkinson patient. I'm 50 years old.
Okay. Go ahead, sir. I'm not able to hear.
I think his audio and his video has stopped.
Yeah.
In the meantime,
Maybe.
I'll ask a question. For the benefit of
Yeah.
everyone, can the main points be highlighted in Hindi? Because some of the patients might not understand in English. The main points which you talked, can you explain it in Hindi again?
You want us to explain in Hindi?
Yes, I mean just a few points. Difficult for you?
Okay, my Hindi is very, very super, so I don't know how to. Okay, kindly excuse for all the grammatical mistakes that I make. Okay.
Gauri, I request you to explain. Gauri, I request you to translate.
Okay. I'll translate. Okay, I'll translate.
Okay.
So डॉक्टरांनी आतापर्यंत सांगितलं की आयुर्वेदाचा उपयोग जास्ती आहे. I'll explain it in Marathi, doctor. So की आयुर्वेद ॲलोपॅथीमध्ये फक्त डिसीज वाईज ट्रीटमेंट दिली जाते, पण आयुर्वेदाचा पर्सन ॲज अ होल विचार केला जातो. आणि वात पित्त कफ या प्रत्येकाची प्रकृती जशी वेगवेगळी आहे त्याप्रमाणे त्या माणसाचा विचार करून पूर्णपणे ट्रीटमेंट दिली जाते. हा मुख्य पॉइंट. त्याच्यानंतर आयुर्वेदाच्या पंचकर्माच्या ज्या ट्रीटमेंट्स आहेत त्यातल्या 2 आयुर्वेदिक ट्रीटमेंट रोज होतात पंचकर्माच्या. फिजिओथेरपी होते आणि योगाचा क्लास होतो. आणि जी काय औषधं त्यांच्या तिथे दिली जातात ती पूर्णपणे 100% आयुर्वेदिक असतात, ती ब्रँडेड असतात आणि ते त्यांची खात्री करून घेतलेली ती औषधं आहेत. सो मुख्यतः आयुर्वेदिक औषधं म्हटलं की आपल्या मनामध्ये असा संशय येतो की याच्यामध्ये त्यांनी काही स्टिरॉइड्स वगैरे मिक्स केली आहेत का किंवा दुसरं काही वापरलंय का. तर ते तसं अजिबात करत नाहीत. ते त्यांचं ओपन चॅलेंज आहे कोणालाही की त्यांच्या औषधाचं कोणीही कुठे लॅब टेस्ट करून घ्यावी आणि जर त्याच्यात काही आढळणार नाही त्यांना खात्री आहे. त्यांची ब्रँडेड औषधं आहेत ती, त्याच्यामुळे प्रत्येकाने त्याच्याबद्दल निर्धास्त असायला हरकत नाही. तसंच त्यांनी इन्शुरन्स बद्दल सांगितलं की माझा स्वतःचा अनुभव सांगते मी. माझ्या बिलापैकी जवळजवळ 95% अमाऊंट मला इन्शुरन्स कंपनीकडनं मिळाली आणि त्यांच्या इन्शुरन्स कंपनीच्या ज्या काही क्वेरीज होत्या त्या डॉक्टरांनी अतिशय चांगलं कोऑपरेशन देऊन पैसे मिळायला मदत केली. आता नाव आय विल आस्क अ क्वेश्चन टू डॉक्टर. Doctor, there are many patients here.
Vidya madam, 1 minute. So meanwhile, sorry, Gauri madam, 1 minute, Gauri madam, sorry, Gauri madam. So in
Yes,
between actually,
please.
just one minute. Yeah, I just want you to explain one more thing, madam. That is the concept I told you know overall rejuvenation of the whole system.
Yes.
Overall rejuvenation of the whole system, not
Oh.
just symptomatically
Yes.
treating the patient on basis of this one. Overall
Okay.
rejuvenation of the whole brain as well as whole system,
Yes.
overall system. That's
Yes,
what I think you
yes.
need to
येस. पूर्ण आपल्या सगळ्या शरीराचं रिज्युविनेशन शरीराचं होतं. कारण जे काय घटक आपल्याला कमी पडत असतात ज्याच्यामुळे आपला मेंदू काम करत नाही तर त्या मेंदूचं रिज्युविनेशन आणि पोषण, शमन आणि शोधन असे 2 शब्द त्यांनी वापरले की आपल्या आजाराचं निराकरण करणं आणि म्हणजे ते दोष आपल्या प्रकृतीतनं घालवणं आणि पोषण करणं. नाड्या आणि नसांचं पोषण झालं की आपोआप मेंदू काम करायला लागेल. म्हणजे डोपामाइन सेल्स जे मेलेले आहेत, ऑलरेडी डेड झालेले आहेत ते तर पुन्हा निर्माण होणार नाहीत, पण जे काही शिल्लक आहेत न्यूरॉन्स आपल्या शरीरामध्ये की त्यांनी उर्वरित काम अतिशय चांगल्या रीतीने करावं यासाठी जेव्हा त्यांना पोषण दिलं जातं तेव्हा पूर्ण मेंदूचं काम सुधारलं की पूर्ण शरीराचं काम सुधारतं आणि अशा तऱ्हेने संपूर्ण आरोग्यावर चांगला परिणाम होतो या प्रकारच्या ट्रीटमेंट्समुळे. आणि आता यांचंच आयुर्वेदिक सेंटर वेगळं का? आयुर्वेदिक सेंटर अशी बरीच आपल्या पुण्यामध्ये सुद्धा आहेत, खूप प्रसिद्ध वैद्य आहेत, डॉक्टर आहेत, पण यांच्याकडेच रिझल्ट का मिळतात? तर प्रत्येक पेशंट वाईज ते विचार करतात आणि या पेशंटला कुठले त्याच्या प्रकृती बघून, वात पित्त कफ बघून त्याला कुठली ट्रीटमेंट द्यायला पाहिजे हे ते ठरवतात. रोजच्या रोज त्यांचं ऑब्झर्वेशन असतं, त्याप्रमाणे ट्रीटमेंट्समध्ये काही बदल केले जातात. कोणाला काही सोचतंय नाही त्याप्रमाणे औषधांमध्ये बदल केले जातात आणि त्यामुळे त्यांना तिथे रिझल्ट मिळत आहेत. आणि जरी तिथे संधिवात किंवा ऑर्थोच्या केसेस सुद्धा जरी ट्रीट होत असल्या तरी मॅक्झिमम बेनिफिट्स रिझल्ट त्यांना पार्किन्सन केसेसमध्ये मिळालेले आहेत. आणि मला वाटतं जसं होत असेल की माउथ टू माउथ पब्लिसिटी होते की एका पेशंटला बरं वाटल्यावर तो दुसऱ्या पेशंटला आपोआप सांगतो, तसं होत गेलेलं असावं आणि त्याच्यामुळे जास्तीत जास्त पार्किन्सन पेशंट्स त्यांच्याकडे बरे होत आलेले आहेत. Doctor, I would like to raise one question. Like the treatments are very costly and I can understand why it is costly because the setup is costly, the medicines are costly. But you have prepared 3 models like 4,000, 5,000 and 6,000 as per the room services or the room sizes. But now though everyone wants to come over there, it's not practically possible for everyone to go to Puttur and stay over there. There are many practical difficulties like people don't have attendant, people don't have cooperation from the family, or many times it's economically not possible. Everyone doesn't have a health insurance, like that there are many problems. So is it possible for you to do a video consultation and you can write down the therapies and the medicines which people can get here in a few cases?
Madam, just before Dr. Prashanth talk about this matter, just let me give 1 or 2, the points. Like, Madam, actually here, the expense part, what you're talking about, frankly speaking, Madam, it is not that expensive at all, Madam, because it is like, it covers everything, like your accommodation, treatment, medications, and all the services which is given, like the economy about what you're talking about. So it is not that expensive. Maybe Dr. Prashanth will talk about that later. And Madam, actually, as we were talking about giving, giving a video consultation and making the points, like making the therapist, or advising you the therapist so that you can do it over there. Madam, it is not practical because you see the patient. Video consultation and all is still okay, but that is in the maybe in the follow-up stages and all as such. Okay, initial stage, Ayurveda believes in basic concept, madam. That is darshana, sparshana, prashna. Darshana, sparshana, prashna. So the basic examination method explained in Ayurveda is darshana, sparshana, prashna. That is darshana. Darshana means you need to see the patient in person. Darshana, sparshana. Sparshana is nothing but you have to examine the patient physically. You have to, everything, that examination part, what physical examination part comes, that's also is there. Darshana, sparshana, prashna. That means, okay, interrogation. That is, you will be asking the question to the patient and all. So when it comes to that aspect, what happens here is, in video consultation and all, sometimes you will not be able to evaluate the patient properly. And if at all we advise some treatment or something like that, madam, actually we don't understand the authenticity of the treatment which you are planning to do elsewhere. Hope you understand what I'm telling. Like actually, madam, actually, okay, we advise, say, for example, we advise some Abhyanga, or maybe Patrapinda Sweda, or maybe Shastra Shalipinda Sweda, or maybe Nasya, or maybe Shirovasti, Shiropich, or whatever. We are not sure about the authenticity of the treatment which is done elsewhere, madam. So once that happens, so it's simply spoiling our name. That okay, I did some, doctors prescribed some treatment, we did it, and it didn't work out. So that's what will be the end product. That for sure we know that actually.
No, costing is only one
Not
part.
a good idea.
Costing, the high cost is only one part. But otherwise, I mean, taking the treatment here, people might not get 100% benefit.
That's what, madam.
Been admitted to your hospital. But at least some benefit they'll get.
Authenticity of the overall outcome, no, madam. We are not sure about it. Sorry, don't misunderstand us. Okay.
Now, I'd like to emphasize on one more aspect in this, that Ayurveda therapists that we have here, they've all been trained in-house after their certification for a minimum of 3 to 6 months before they're allowed to practice on the patients. What happens is, each hospital has their own school of thought and their own style of practicing. Whereas we have been getting good results with whatever protocol that we have formulated, and these therapists have been trained to do so, which we do not know how it will be when we refer to some other place with our prescription. Hence, it is practically not possible for us to prescribe any therapeutic procedures to be undertaken at a different center without our supervision. Yes, one thing. Second thing is, yes, I do agree that the expense is quite high, runs to lakhs together, around at least 2 lakh rupees per session. Yes, I do understand, but sadly, I cannot see any which way that I can reduce the cost here. We are doing at a very minimal expense, very minimal cost, but that I do understand is quite expensive to some patients. But frankly speaking, I am helpless on that part. The Ayurveda treatments are quite elaborate, and the medicines used are quite expensive.
Yes, I understand. आणखी कोणाला प्रश्न विचारायचे तर विचारा.
मी प्रश्न विचारतो.
I do not understand.
तुम्ही डायरेक्ट प्रश्न विचारायला सुरुवात करा, हिंदी किंवा इंग्लिश मध्ये. डॉक्टर बोलतील. तर आपण विचारू का त्याने हो म्हणायचं, त्याच्यात वेळ जातोय खूप.
अरे माझे ना तळपायाला औषध जमिनीवर ठेवूच नाही शकत. मोजे घालून चप्पल घालूनच चालावं लागतं. त्याचं कारण काय आहे?
She says she can't put her feet down on the ground, and she has to wear socks all the time. So she says, what is the reason?
No, that I think
Cannot be assessed now here. Yeah, unless physically examined, difficult to tell.
ताई तुम्हाला बघितल्याशिवाय नाही त्यांना सांगता येणार काही, कारण त्याच्यामध्ये अनेक गोष्टी इन्व्हॉल्ड असतात ना. जसं ते म्हणतात पूर्ण प्रकृती इन्व्हॉल्ड असते, त्याच्यामुळे नुसत्या एका लक्षणावरनं नाही सांगता येणार की हे काय कारण आहे असं.
हो हो हो.
दुसरा
आणि
प्रश्न
मला डाव्या पायाचा ना अंगठा असा एकदम वर होतो. आणि
तेच
पूर्ण
आहे की नुसतंच एका लक्षणावरनं त्यांना नाही सांगता येणार. पूर्ण शरीराची तपासणी करायला लागते, तुमची औषधं काय चालू आहेत ते सगळं बघायला लागतं, हिस्ट्री घ्यायला
अच्छा.
लागते, त्याशिवाय नाही सांगता येणार.
अच्छा. थँक्यू.
Hello,
Yeah,
doctor.
Yes, sir.
Can there be any diet or any lifestyle would you recommend to prevent Parkinson's problem? Yeah.
Prevention is difficult because most of the time we will not be aware of the cause itself. But for all Parkinson's disease patients, we suggest animal product free diet except buttermilk and ghee. We suggest low protein and animal product free diet. The only two products that are permissible are ghee and buttermilk.
Okay. Thank you.
डॉक्टर
Nice to
म्हणतात
see Mr.
आणि
Prashanth
दुधाचे
Jana.
पदार्थ चालणार नाहीत, अॅनिमल प्रॉडक्ट्स कुठली चालणार नाहीत, फक्त घरी केलेलं ताक आणि घरी कडवलेलं साजूक तूप एवढेच दोन पदार्थ चालू शकतील, बाकी दूध आणि दुधाचे पदार्थ नाही. डॉक्टर, टॉक लिटिल अबाउट नॉन व्हेजिटेरियन डाएट ऑल्सो. यू हॅड एक्सप्लेन you don't allow non-vegetarian diet also.
No, basically, it is not just Ayurveda, or it is not just in our hospital. I am telling you, animal products interfere with dopamine production. So, even in allopathy system, even in Ayurveda system, in our hospital also, we do not prescribe for any animal product except ghee and buttermilk. Those are the two very clarified products from milk which can be used. Otherwise, even milk and curds are not to be used by Parkinson's disease patients.
And no sour fruits also.
But actually, no, depending upon the comorbid condition, you can use fruits and all. There is no contraindication for using the fruits. But as per basic Ayurveda principle, Ayurveda says you should not mix sweet and sour fruits together. Okay. Say, for example, if someone with the Parkinson's disease is diabetic also, then naturally there is no question of eating any fruits. That is, only limited permissible fruits are only advisable. And just think that patient is not diabetic, still he can consume fruits depending upon any other conditions or any other related issues. If there is nothing, just only when it is related to the Parkinson's disease, there is no contraindication of eating any fruits or natural products. But the problem is anything in excess should not be used. And Ayurveda basically believes that sour and sweet fruits should not be mixed together. If you want to eat some sour fruits, provided if you don't have any acidity or anything of that sort, that you can have. If you are having no other issues like diabetes or anything, you can have any sweet fruits, madam. For that matter, there is no contraindication.
Doctor, just in case we plan to come there and do the treatment, what's the duration you recommend?
Duration of treatment we recommend is about 4 to 8 weeks.
Okay, 1 month roughly, 1.5 months.
1 to 2 months in the first session, and most of our patients are discharged by 42 days. We have a set treatment program for about 6 weeks, which covers all basic therapies and sufficient time to get the patient back on feet.
Got it. Why I ask this question, doctor? Because 7-8 years back I've been to Bangalore, and this Vivekananda Center there in Bangalore. So I've been there. I was there for 1 month. I've been through almost similar kind of treatment with Panchakarma and everything. And that time they introduced this macunopurin, that capriccio powder. Okay.
Okay.
And, actually, my personal experience in this case is like once you relax for 1 month time with daily massage and this and thing, you're bound to rejuvenate. You're bound to feel better. But after coming back and again settling back into the life, daily routine, I think within 1.5 months, 2 months, again we start getting into original state. So what do you have to say on this particular thing?
Yeah. What we suggest is, as you rightly said, 1 to 2 months of massages and different therapies, you are bound to rejuvenate. Yes, correct.
Yes.
We give you a very fixed diet, medicine, and lifestyle program when we discharge you from here. And that needs to be followed strictly at home. Okay, we do not ask you to undergo any rigorous massages or any therapies at home. We ask you to follow the simple diet plan that we give you. One. Second thing is certain medicines that you prescribe, you need to continue. And third part is to keep you physically active. We ask you to have a physiotherapy session at least 2 to 3 times a week. Maybe you can hire a physiotherapist somewhere around in your town, or you can go to a nearby center and or you can follow physiotherapy that we prescribe ourselves. You can follow at home by yourselves also. Any which way to keep you physically active. These 3 things, the diet, the lifestyle that you prescribe, and the medicines that you prescribe, will definitely keep you in a good state for quite a long time. And most important, we ask you to come back for a follow-up treatment session anytime after 3 months before the completion of 1 year.
I see. Got it.
Yeah, and in our hospital, usually at any given time, we will have at least 1 or 2 patients who have come back for follow-up sessions.
I see.
Usually, for follow-up session, we suggest 3 to 4 weeks of admission here. In the first instance, it is 4 to 8 weeks. In the second follow-up, we ask you to come for 3 to 4 weeks. Okay. And most important point, those who have been following our prescribed regimen, most of them, 99% of them have all been doing good. Those who are, for whatever reasons, who are not able to follow our regimen, sadly, their conditions questionable. Yeah.
Questionable. But doctor, when you say, yeah, sorry.
Yeah.
When you say you give prescription certain kind of medicine, these are what allopathy medicines or purely Ayurvedic medicines?
100% Ayurveda only we prescribe. As I already told you earlier, we prescribe branded sealed medicines, which maybe you can take it from us or you can buy in your place. It is not like many people ask me, so what is the secret formula? What is the secret medicine that you use? We have a very simple answer. In our hospital, we have no secret formula. I have absolutely nothing specialized in my hospital because what we are using are all prescribed in Ayurveda text 3,000, 5,000 years ago. The same medicines in a judicious way, with the wisdom of the physician, we are prescribing.
Now, why I ask you this question?
Yeah.
Particularly because I stay in Dubai.
Yeah.
So normally I bring the stock with me, but there is a limit which I can bring. Probably 1-2 months medicine I can bring, but not more than that. So is it possible if I come down there, we meet and sit together? Is it possible to get this medicine across here, or how is it like?
No, what we would suggest, we will not send you, we will not give you a year's medicine. We will send you through courier and by post, depending on your condition. Because what we do is, for each and every patient, at the end of the month, we ask you to get back to us, call us, maybe send us a video or just a phone call, WhatsApp, whatever it is. And if you give us a fair idea about your condition, we can send you the follow-up medicines accordingly for the next month. Instead of taking for years together, you can take it by 1 month or 2 months at a time.
Basically, it's customized.
Hello.
Hello.
Yes.
डिस्कायनेशिया कसं कमी करता येईल?
सर
अनवॉलंटरी मूवमेंट.
हेलो.
Yeah.
Hello.
Involuntary movements.
हाँ सर, मेरी DBS हुई है मार्च 20 में, तो कैन यू ट्रीट द पेशेंट ऑफ पेसमेकर ऑफ
Come again,
पार्किंसन?
come again. Once
I
again,
had undergone the DBA surgery in March 20. So can you also treat the patient of Parkinson with pacemaker?
with pacemaker is different, DBS surgery is different. I would like to know
Cardiac pacemaker or DBS, which one?
cardiac pacemaker or DBS.
DBS related to brain. Parkinson. I am Parkinson's patient.
Okay, once DBS is
Uh.
done, we are not sure of the outcome
Okay.
because the main target organ, that is the brain, has been tampered with.
Okay.
So how effective our treatment will be remains a question mark. We can definitely make a sincere try, but with a firm disclaimer that we do not know because the target organ has been tampered with during the surgery.
Acha.
So
Okay.
we cannot be sure.
Okay.
Dyskinesia, involuntary movement.
Involuntary movement is quite common in most of the patients who have overdosage of the medicines. A little underdosage and they become frozen, a little overdosage, the involuntary movement starts. So a balance may not be possible with certain medication. So that is where Ayurveda comes into picture and we can make a better balance.
Yes, sir.
So what I understand from your discussion, that your Ayurveda is mostly based on rejuvenation of the system. So is it affecting the production of neurochemicals?
Come again, madam, the voice was not very clear.
Does the rejuvenation taking your Ayurveda medicines, is it affecting the production of neurochemicals?
Can somebody repeat the question? Gauri, madam?
She is asking whether Ayurvedic medicines can help in the production of neurochemicals again.
The aim of the treatment is to rejuvenate the brain in the first place. And once the brain cells are rejuvenated, there is every chance of dopamine secretion getting increased. And that is the reason why we are able to reduce the Syndopa tablets. Syndopa is the dopamine substitute that you are using. And in most cases, we are able to reduce the Syndopa dosage because the brain got rejuvenated and is starting to produce the required dopamine.
Yeah, and of course, madam, we have our target specific medications also, which contains, dopaminergic, drugs like what we call Pikachu and combination of that. So together, that is with the help of the medicine as well as with the help of the therapy, of course, we can increase the, rejuvenation of the brain and in turn increasing the neurochemical activities of the brain. Yeah.
And nowadays, much is talked about the blood-brain axis for neurochemicals. So it is more affected because of the gut bacteria and the production of those neurochemicals. It is getting modified because of your gut bacteria. So does this treatment also gives any reference to this? These gut bacteria are there.
Madam, can you repeat? Gauri, madam, can you just repeat the question? Like what did she
Even
ask?
she is not audible enough. She's not clear. Her voice is disturbed. I didn't also get that.
गौरी ताई,
Can you hear now?
गौरी ताई मला एक प्रश्न विचारायचा.
हाँ बोला.
डॉक्टर जाना,
Yes, sir.
Jana,
Yeah.
are you from Odisha?
I am from Karnataka. I am born in this place, Puttur town. I am from Karnataka. I am not from Orissa.
Thank you.
That's a common question I ask. I get from most people from Orissa and Bengal.
Because I know many Janas who are from Odisha, but you don't look like Odisha.
I am not from Orissa. Karnataka only.
Okay.
So I can share my experience that after coming back, I came back, I stayed for 32 days. I came back on 21st January and now it's 14th of March today. I have been following the protocol given by them. Like Dr. Ramchandra has asked me to do and undergo massage every alternate day, but which I'm not able to do. But once a week I'm taking the massage and once a week the basti too. And with all the medications, I'm maintaining very good health as it was there. My Sendopa tablet, it was reduced there to 1/4 quarter pill twice, and the same is continued here. I am doing the exercises regularly, the yoga regularly, the physiotherapy exercises also every day, and going for evening walk every day. So once you follow the protocol, what is given by them, then you can maintain your health. There is no question about it. Like someone थोड्या वेळापूर्वी कोणीतरी म्हणलं की घरी आल्यानंतर पुन्हा हेल्थ जाते आपली. तिथे असताना सगळ्या ट्रीटमेंट चालू असतात तेव्हा आपली हेल्थ चांगली राहते, पण घरी आल्यानंतर काय? तर ते आपली जबाबदारी आहे. इट्स आवर रिस्पॉन्सिबिलिटी दॅट वी डू एव्हरीथिंग व्हॉट एव्हर इज टोल्ड टू अस and then we can maintain good health. There is no question about it. It is not that health is maintained only if we are admitted over there. It is our job also to follow it.
Exercise करू भी त्रास होतो.
Yes, madam.
I do my daily exercise twice a day.
Exercise is definitely most important, man.
Daily I do.
Keeping yourself physically and mentally active is very, very important.
All types of
One. Second,
yoga also I do.
Good, ma'am. Good. Continue. Whatever suits you to keep you physically and mentally active. And somebody asked me what diet I suggest. Along with the medicines and the diet, most important is to keep yourself socially active. All of you, please come out of your cocoon, come out of your shell and meet people, be friends, be happy, be socially active. That will keep you very, very active, very, very healthy.
That is the main purpose of forming this group by Shobana Tai Tirthali, and she makes it sure that everyone participates and she conducts various activities every month or every fortnight. The activities are conducted so that people meet each other at least on the Zoom meeting also and in person also in between. So socially we are active and the group is benefiting a lot.
And I would also like to emphasize one more point here. We call Parkinson's disease and associated condition, all of those conditions, as psychosomatic disorder. That is, there is a definite involvement of body and the mind. So it is most important to keep your psyche, the mind also happy, and the family members and the friends form a very important aspect in this condition. Hence, a good support from the family, and sometimes the family members, for whatever reasons, may not be around to help you out. Your friend circle can definitely help you out. So whenever we ask any patient coming over to our hospital, we ask them to come at least one and a family member preferred. If for whatever reason a family member is unable to come, we ask you to come with any of your close friends. Okay, somebody who can accompany you, somebody who can share your joy and sorrow, somebody who can be with you at all times. That will help in the recovery process faster.
Madam, having said that,
I have one question to Dr. Ram.
Just want to emphasize on one more thing. Madam, actually, at this point of time, just depending upon just one system of medication to just get some symptomatic relief from the symptoms, that is whatever the symptoms Parkinson's disease patients have, it's always advisable to have a multiple approach which includes the best of the best from every system talking about, that is Ayurveda, physio, yoga, And sometimes in some cases, of course, if they are already on allopathic medication, sometimes that may, just like as Dr. Prashanth said earlier, sometimes that needs to be continued as well, at least in the initial stage. So instead of just depending on any one particular just system of medicine or simply some tablets like Sindopar, whatever may be the tablets, it is always advisable to have a multiple approach so that in the years to come, we feel better, we are active, we are happy, and we are always productive. That's what we emphasize on. Because actually, madam, sometimes, if you come to our hospital, of course, you might have seen elsewhere as well. When you come to our hospital, you will get to see that rather most of our patients are not at all in a condition, of walking. They're not at all walking. Most of them might have lost hopes in all, in all system of medicine. Or most of the time, it's that they are not at all interested in getting better. So why all these issues are happening is they initially just, they were dependent on they were dependent on only one system. That is even earlier, even not only earlier, even nowadays also, no neurologist or nobody advises you to just follow any other system as well. Just only, as and when you start visiting them, they will prescribe medicine upon medicine upon medicine and keep on increasing the dosages and all. But nobody advises to have a multiple approach so that in the long term, in the sense, maybe from 5 years from now, maybe 10 years from now, then also you need to be active and productive. But the approach is missing now. So what I would like to request to the population as a whole, or patients as a whole, is that as soon as the disease is being diagnosed, or else as soon as you feel like something is wrong with you, so please just don't depend on one system. Just be okay. You take medications, just have a multiple approach. Include Ayurveda also in your regime. Include food also, that is diet also as a part of your disease healing. Yoga also as a part of your healing. Regular exercise also as a part of your healing. So when you understand all these issues in a broad way, I'm talking about, definitely things can be made much better than what it used to be earlier. Okay, but only thing is early approach is always better. As we all know, when the condition has advanced to an extent wherein which there is nothing which can be done, like only DBS and other things are being advised. Even in such cases also, we try to give maximum possible results. But the problem is, if you are coming, I'm not saying our hospital, any authentic centers I'm talking about. If you are approaching them at the early point of your early stage of your disease, it becomes easy for them to give you good treatment. At the same time, the benefits which you are expecting will also be much more than what you really expected. Okay, so it is easy for the doctor as well as it's easy for you also. That is, as a patient, I'm talking about. So that if you approach, if you have a multiple approach, then things will be fine for next 10 years, at least 15 years to come. Then, of course, madam, from now onwards, 15 years onwards, nobody knows what's going to happen. So my kind request is, as I'm not talking about that you need to come to our hospital, but at the early stage of your disease, do include Ayurveda also in your regime, so that definitely your dosage and other things like Sindopar, from starting from half to, we have seen patient eating 15-20 Sindopar per day also. So that and all can be potentially prevented. And of course, with the rejuvenation approach, what we are talking about, as much possible, brain degeneration can be retarded. At the same time, whatever may be the possible, like rejuvenation of the brain can be achieved. That's what I want to tell you.
Doctor, can I ask, doctor?
Yeah, yes, ma'am.
I just wanted to ask you whether a patient can come out of depression, because that is also one of the signs of the Parkinson's disease. So does the Ayurveda?
Yes, definitely. Depression, we have seen a lot of our patients who have been depressed when they do approaches, and with the help of Ayurveda treatments, yes, you can come out of depression much easily.
Yeah, that's what, madam. There are specific medication, of course. It's being a psychosomatic disease. Of course, there are some medications which are indicated, and very important thing is certain medications in Ayurveda which we use like ghritam, that is medicated ghee, tuppa, what we say. So when we use certain medicated ghee, of course, it improves the brain function as well. So most of the medications which are indicated for Parkinson's disease, they are both psychosomatic. That is, they work on the mind also, at the same time on the body as well.
Getting out of depression is easier, definitely much easier with Ayurveda.
But again, there is no chance of going back. They won't be going back, are you sure?
Depends on the factors at home, because causative factors have to be avoided at any cost.
And the person, I think, should be positive. Then only he faces.
A positive attitude is definitely needed. A positive atmosphere is needed.
Right.
Positive social family background, all these things does matter. Yes.
And the way he thinks on the works also, I think that also matters a lot.
Everything is whole mental makeup. Yes.
Madam, involvement of the family to come out of the depression is paramount. Okay, unless and until there are some family members to support you, maybe your spouse, maybe children, maybe relatives or whomever it may be. Unless and until someone is there firmly on, on behalf of you, it is impossible to expect to come out of any depression or anything of that that kind of psychiatric issues. Okay. So unless and until you have to have a firm, supportive family so as to get out of this all mental illnesses.
I have two questions.
Thank you so much.
What about hallucination?
Yeah.
And second is, how many PSP patients treated in your hospital, and what is result? PSP patient.
Hallucination is usually we see in almost all patients who have been in the advanced stage and who have been on allopathic medicine for a long time, usually as a side effect of the medication. With our treatments, most of our patients have been able to come out of hallucination. It's not a big issue, not a big issue. And second question was, how many patients have been treated by us?
PSP, Parkinson suprapalsy.
Yeah, progressive supranuclear, day in and day out, madam.
Video.
Half the patients you see here are PSP patients, and we have been treating thousands, not hundreds, thousands. Even today, if you are to come, you can see half.
7 to 8 patients.
Yeah, out of 14, we have about 7 or 8 PSP patients.
One more question regarding this psychosomatic issue. Can you hear me? Can you hear me?
No, you are not audible.
Not very clear.
Thing is wrong with your phone or with the Wi-Fi.
तुमच्या वायफायला प्रॉब्लेम आहे किंवा फोनला प्रॉब्लेम आहे शैलजा?
दोन फोन चालू आहेत का विचारत त्यांना? दोन फोन चालू आहेत का?
Can you hear me? Sir, doctor, I want to ask about that psychosomatic issue. Usually it is found that some trauma has happened previous to this Parkinson onset. So does Ayurveda believes in this, and how it is treated?
Yeah, of course. We have usually all the Parkinson's patients we get, the causative factors which we have to enumerate. One, maybe a head injury or any kind of injury. One. Second thing is drug-induced Parkinson's. We see a lot of people on long-term medications, allopathic medicines, have been found to be having Parkinson's disease. Third thing is the psychosomatic factors that you just spoke about, like trauma, mental trauma, or loss of family member, and all these associated conditions resulting in mental breakdown can result in Parkinson's disease. Yes, we have seen. And as Dr.
Any
Ram said,
counseling sessions are there?
pardon me?
Any counseling sessions also you arrange for it?
No, counseling
Counseling
session may not be possible because that is a very, very lengthy process. 1 or 2 days, 4 days counseling will not help in these kind of conditions. We concentrate mainly on therapies and treatments, physical treatments, Ayurveda treatments.
And I have heard about one gut brain drops. GBA drops. GBA drops from banyan tree. From banyan tree, some drops are made, and they are affecting the bacterial levels in the gut, which ultimately affects the production of neurochemicals in the brain. So
the second part I am aware.
These are Ayurveda. Does it your treatment also involves such kind of medicines?
No, we do not know the GBI drops or whatever you mentioned. I am not aware of those drops. But the second part, yes, very much, because gut flora is the most important aspect to be taken care of in Parkinson's disease, which is mentioned now in Western medicine, but which has been followed for about 5,000 years in Ayurveda. We do something called as Basti treatment.
Yes.
Basti karma is intended to take care of your gut only, in the route to the brain through the anal route. That is the Basti treatment.
Yes, yes.
Yes.
And some nasal treatment also, they say that
Nasya karma.
nasal drops.
Nasya karma. Yes, yes, we do that.
Okay. Thank you, sir.
Namaste, ma'am.
आणखी कोणाला विचारायचंय का काही?
I see Miss Prabha Ranade also, and I think that is Mr. Ravindra Ranade. They are coming on 8th of April.
And we have seen Vadame sir, Pratap Vadame sir.
Hi. I'm here, sir.
Namaste,
Very
namaste,
happy
sir.
to listen to you, both of you. I'm very happy.
Hello, sir. Namaste.
Namaste, Nilima madam. Namaste.
Yes. We are very happy to see you, to see both of you.
Thank you.
Nice to hear. Nice to see you too.
Yeah,
Nice to see you smiling.
Yeah, doing very well, sir.
And very, very
Doing very
special.
well.
Pardon me?
We are enjoying.
Nice, nice.
Very nice, madam. Life is there to enjoy only.
Yeah, very special thanks to Dr. Vidya Kakre, who has been
Yes, yes, of course.
to get all together here.
Of course, of course.
And of course, Gauri madam also.
Yes.
Gauri, I would like to say something.
हो बोला ना विद्याताई बोला.
Yes, ma'am.
Dr. Jana and Dr. Ram, thank you so much. You came and you spoke. I was dreaming about the Zoom meeting for a long time. And thank you, Tirthali Vaini and Gauri. This came true. Thank you very much.
Thank you. Thank you.
Thank you, everybody.
Yeah. I would like to share one more experience here. My American neurologist, who practices in New York, Dr. Sarah, she had come to India for a short visit. And with my recommendation, kiva maza thoda sa agrah, she did visit the Puttur center. She met Dr. Jana and Dr. Ramchandra, and she was highly impressed about their therapies, their techniques. And she thanked me a lot for arranging this visit. And then later on, she said she is going to apply for a Fulbright scholarship to study more in Ayurvedic therapies. She's impressed so much. आणि डॉक्टर सारा आयुर्वेदाकडे वळले. खरं तर ती व्हाईट अमेरिकन न्यूरोलॉजिस्ट आहे, न्यूयॉर्क मध्ये प्रॅक्टिस करणारी. पण तिचा विश्वास आयुर्वेदावर आहे. तिने ह्या सेंटरला यांच्या व्हिजिट केली, ती अतिशय इम्प्रेस झाली आणि तिचा सगळ्यावर विश्वास आहे. आणि त्याच्यामुळे मी आता माझं पुण्यामध्ये कोणीही किंवा भारतामध्ये कोणीही अलोपॅथिक न्यूरोलॉजिस्ट कडे मी जात नाही. मी फक्त आयुर्वेदिक औषधं आणि सेंडोपा प्लस एक सपोर्टला थोडीशी काठी असावी आधार, तसं मी पाव गोळी फक्त घेते 2 वेळा. बाकी माझा पूर्ण आयुर्वेदावर विश्वास आहे आणि त्याने मी चांगली बरी होतीये हा माझा विश्वास आहे आणि हे मला दिसतंय. शोभनाताई, समारोप करायचा का? सगळ्यांचे प्रश्न झाले का विचार?
सगळ्यांचे प्रश्न झाले असते तर. आणि मला सगळ्यात गौरी महत्वाचं सांगायचंय की तू फॉलोअप नीट घेते, त्याचं तू इन्सिस्ट कर. फॉलोअप इज व्हेरी इम्पॉर्टंट.
Yes, ma'am.
Follow-up is important. I keep chatting with them, and the moment I give on my first ring, Dr. Jana picks up the phone. And Dr. Ram also answers immediately because they're busy at times. I keep chatting, I keep sending messages, but they give immediate replies, and all my queries are answered every time. So I'm very happy with the follow-up also. आणि प्रत्येकाने फॉलोअप केला पाहिजे. घरी त्यांनी सांगितल्याप्रमाणे सगळं ट्रीटमेंट जर व्यवस्थित आपण पाळल्या, आपण आपल्या आरोग्यासाठी हे करतोय, त्याच्यामुळे ही आपली जबाबदारी आहेच ना, की डॉक्टरांना पैसे दिले म्हणजे आपलं आरोग्य आपण त्यांच्या हातात सोपवलं असं नाहीये. आपलं आरोग्य राखणं ही आपली जबाबदारी आहे. ते आपल्याला फक्त मदत करतात, हेल्प करतात. अल्टिमेटली इट्स आवर ओन रिस्पॉन्सिबिलिटी टू कीप आवरसेल्फ फिट अँड हेल्दी. सो टू फॉलो द रेजाइम प्रॉपर्ली इज आवर रिस्पॉन्सिबिलिटी. आणि इफ वी डू दॅट, मला वाटतं डिफिकल्ट कंडिशन मधनं सुद्धा लोक बाहेर येतात. तो ज्यांना शक्य आहे त्यांनी नक्की या पुत्तूरच्या सेंटरला जावं. की कुठेही त्यांची ऍडव्हर्टिजमेंट नाही. तुम्हाला शक्य असेल, तुमच्या घराजवळच्या सेंटरला तुम्हाला जायचं असेल, तुम्ही तिथे जाऊ शकता. आपल्या सगळ्यांच्या विनंतीला. हा, बोला.
हॅलो,
बोलायचंय कोणाला?
डोईफोड्याला बोलायचंय.
बोला बोला.
पाल्सी न्यूरो टॅबलेट विषयी काय आपलं?
What is your opinion about palsy neuron tablet?
That can be had.
Palsy neuron.
Yeah, that can be had as a supplement. That can be taken, madam. There is nothing wrong in that. There is nothing wrong in that. That can be taken.
घेऊ शकता असं डॉक्टर म्हणतात. त्यांची हरकत काही नाही ती घ्यायला, ऍडिशनल सप्लिमेंट म्हणून. पण ती सेंडोपाला रिप्लेसमेंट नाही होऊ शकत. इट कॅनॉट बी रिप्लेसमेंट फॉर सेंडोपा.
No.
त्याच्यामुळे आपल्या मनाने काही घेऊ नका. ऍडिशनल घ्यायचं तर आपण रिप्लेसमेंट म्हणून घेऊ नका.
ठीक आहे.
किती वर्ष?
आणखी विचारायचं कोणाला काही? आणखी विचारायचंय कोणाला?
किती वर्ष जुना पार्किन्सनचा पेशंट, म्हणजे पार्किन्सन डायग्नोज झाल्यानंतर किती बरेच वर्ष झाली आहेत, असं मॅक्झिमम किती वर्षानंतरचा पेशंट त्यांनी ट्रीट केलाय?
Like a patient with how long, I mean the condition of Parkinson, since a long time, since many years the person is having Parkinson. What is your experience of treating such kind of patients?
How many
So
years?
what was the maximum
We have treated patients 15-20 years, suffering from the past 15-20 years. So the duration is not a problem. But the severity and the physical condition of the patient is important. If the patient is too weak, too frail to undergo Ayurveda treatments, then we may not be able to treat, but the duration is not a criteria.
Okay, thank you.
So maybe in some cases the disease progresses very fast, like within 2-3 years also, and in some cases it doesn't progress so fast. So 15-20 years also people can manage.
True. And usually, if it is classical Parkinson's disease, it does not progress very fast. The other associated conditions, PSP, MSA, these cases progress very fast as compared to Parkinson's disease.
Okay.
And one more important point to note is Parkinson's disease as such is not life-threatening.
Correct.
And with our treatment, we can expect to improve the quality of life of the patient.
So दोन्ही डॉक्टरांनी आज आपल्यासाठी वेळ काढला. Both of you spared a lot of your time for us, more than an hour you are talking to us. And we are very thankful to you from our group. And we would request you to come again.
Sure, we can. Nice to see you all, and nice to see so many nice people around in one frame. Okay, yes, correct. And definitely we can get back, and we can have discussion frequently, quite possible. Okay, and 4:30 to 5:30 is the ideal time for us also. And once again, very nice to see Dr. Vidya, Ms. Gauri, Neelima, and also our future patient Prabha Ranade also there. They're scheduled to come next month. Happy to see you all. And yes, Mr. Pratap.
Thank you so much. Thank you so much. Thank you. Thank you.
Thank you.
And wishing the best of health and life to all.
Thank you, doctor.
Thank you.